June this year, the government deployed 107,831 community health promoters. But the big question is, in particular places where these community health promoters cannot actually access you as the user, you as a common mwananchi, how do they actually get there? You know, when you take a look at the road infrastructure, the kind of kilometers that they really need to walk. Well, that is where World Bicycle Relief comes in. And this particular morning, we are joined by the regional director of this non-profit organization, Maureen Kolenyo. Good morning.
Good morning.
Thank you for making time to join us today.
Thank you for having me here.
Kindly tell us, who is Kolenyo before we continue?
Okay, so my name is Maureen Kolenyo. I'm a mother of 5 children, a career woman, trying to make an impact, changing the lives of people in this community.
Right. So even as we continue, we're going to be showcasing, even for the audience, these types of bicycles. But first off, I mean, there are different forms of transport.
Yes.
Why bicycles?
The issue is there is mobility poverty, whereby people cannot access transport, people cannot access any form of when you're talking about essential services, they are not able to access it because of transportation. That has been a big problem in society. You have people who have vehicles, who have motorbikes, but there are people who are walking. And distance has become a challenge. That's because they have access. They do not have access to any form of essential services.
Right.
So the bicycle becomes a solution. The bicycle becomes a solution because it helps to elevate that distance. People are able to walk, or people are able to ride into different areas to be able to access essential services.
Right.
So that's why we use the bicycle.
I understand that World Bicycle Relief has been in existence in the country way even before the Kenya Kwanza government was in and, you know, started deploying CHPs. Could you tell us a little about the history of World Bicycle Relief in the country, the kind of progress that you have had so far?
So World Bicycle Relief has been in the country since 2010. Initially, when World Bicycle Relief came in, it was doing programs specifically to education, to support learners to access education. In 2014, it evolved and started doing communities, mobilizing communities. And we think about access to farm, access to markets, access to health and education. So those are the 3 areas that we currently focus on. To ensure learners get to school, to ensure that health promoters access households, and finally, how do we broaden economic opportunities? So that has been the evolution of World Bicycle Relief, and our focus right now has been on health.
Right.
How do we ensure that everybody has access to universal health care?
Okay. So how does it work, Kolenyo? Because let's say, for example, right now, my village is deep down in Kisii, county somewhere there, Yamacho there, and there's a community health promoter there, or I am a community health promoter, and the area that I cover, cover about, let's say, 30 families thereabout, that locality. So are you going to give me a bicycle? Do I buy the bicycle? How does that work?
So just to bring it back, community health workers or community health promoters, this is an initiative of the government, working with the county governments. So we currently work with county governments, or we work with partners who work with community health promoters. And so that's how we identify them in the communities. So we work in various counties in Kenya, and we'd work with the county government to identify who are the community health promoters in that county. Once we are able to access them through the ministry within the county, then we are able to allocate bicycles to the community health promoters within the communities. So one of the things we need to start doing is to create awareness, because a community health promoter needs to access households, and that has been a challenge. And we have data that confirms that they are not able to access those households. As you so rightly say, 30 households, actually the number is 100 households, and with no form of transportation. So this has been a barrier for them to be able to achieve their objectives. So that's why we come in.
Right. Is this CHP taught how to probably use this bicycle? Could you tell us more about all that, and also the progress so far of how this has transformed the accessibility of healthcare?
Yes. So, I mean, bicycles have been here for centuries, and most people can be able to ride.
I can't. I just have to put it out there, ladies and gentlemen, I can't be able to ride a bicycle.
Well, I need to take some time with you and actually show you how to ride the bicycle. So, but we do ensure, when we're doing the distribution, that's one of the things we do. We talk about the safety, we talk about how to ride, but remember, as an organization, we also are interested in the whole bicycle ecosystem. So we show them where the access is in terms of mechanics to support the bicycles, and where to get the spare parts.
Right.
So the bicycles have a 5-year warranty, so it's important that they live the time. So for us, it's the whole bicycle ecosystem. So it's not just the transaction of giving a community health promoter a bicycle and leaving it at that. How do we ensure that the community health promoter can have this bicycle in the next 5 years, in the next 10 years, and beyond?
Right. You mentioned that you definitely partner with county government. So in turn, you will be partnering with the Ministry of Education as well as the Ministry of Health, even in these particular county governments. But then, how about the Ministry of Transport? Because yes, you're giving me a bicycle as a community health promoter, but the road that I'm going to be using is dilapidated. So is there a partnership with the Ministry of Roads to ensure that this road that I'm going to use this bike on is good?
Absolutely. When you look at it, this is why we're having this conversation. Because aside from just having the bicycle, there has to be access to proper roads, to safety, to regulation that governs the riding of bicycle, not only in rural, but also in peri-urban and even in urban setups. Because there are places here in Nairobi we can't even ride, because of course there are no access. So by creating awareness, and that's one of our pathways as an organization, is to influence stakeholders, influence governments, to create awareness, to create roads, to create regulations, to support safety riding within our localities.
Right, so it's a work in progress.
It is a work in progress. It's continuous in progress. There are different stakeholders, different priorities. How do you ensure that we do this? And remember, we can't do this alone. We need everybody to come on board. We need your voices to make a difference so that this voice can be heard across, and to ensure that in that rural Kisii, as you said, that mama in the village has access to health, primary health care, and that's what we are looking at.
Right. From where you sit as the regional director, you eat and breathe matters strategic management. That's what you started in University of Nairobi, and I believe you're also doing a PhD right now in the same. So you understand strategic management.
Yes.
You've been in the whole courier service for a while now, for many years. So you definitely understand that bit of logistics and all that. But then when you tie logistics as well as now health as well, speak on that now in the 47 counties, what do we need to do?
That's a great question, because this is about change. This is about what the World Health Organization has said, universal healthcare by 2030 for all citizens of the world. We are part of the process. We have to make that difference. The only way Kenyans are going to have access, especially when we're talking about all Kenyans, is through our community health promoters. You talked about 100 that were initiated early this year. Out of these 100, as the name suggests, they do not have any form of transportation. How do we ensure? Of course, there are areas that the bicycle has no accessibility, but we do need to have that conversation as stakeholders, as people of interest, that how do we ensure that everybody has access, to health. One of the roles of the community health promoters is what we call referrals. They go to a household and find somebody seriously sick, but they're not able to go because they do not have transport to go to the health facilities. With the bicycle, they're able to put the patient at the back of the carrier and ride them back to the health facilities. So it needs to be amplified. That it's not only important to ensure that there is equipment in the health facilities, there are doctors in the health facilities. We also need to say that you need to access those health facilities. How does the individual deep in Siaya deep in Kakamega, deep in Kwale, access any health facilities within the vicinities that they are? Right. What are the numbers of health facilities? So this conversation cannot be had by one individual. We need all stakeholders to come to the table and really see what is the solution to ensure that we are not, there is no challenge that we are able to access health by virtue of bringing the health either to the household or bringing the person to the health facility.
Let's say if Mohammed cannot go to the mountain,
absolutely,
the mountain
should go to Mohammed.
One sector that, as you say, all sectors coming together, one sector that I believe should also be part of this is the Ministry of Energy.
Yes.
Because right now we're talking about sustainability, and electric bikes and bicycles are becoming an in thing in the country. Is this something that the kind of buffalo bicycles that we should be seeing?
Well,
I mean, are they there?
Yes, there's e-mobility. E-mobility is coming right away, but the cost of e-mobility is also very expensive. The cost of purchasing one mobile bicycle is probably 3 times the price of a normal bicycle, that the one we are currently using. So we always talk about accessibility. I mean, you can talk about buses carrying more people, you can talk about matatus carrying more people, but then how are people able to access? And one of the things that's very clear when we're talking about last mile mobility, that's the last mile, that's you and I. How do we access what kind of mobility? What is affordable? And that's how we need to look at it. And even when you look at mobility in terms of how to maintain it, in terms of the electricity, of charging of the battery and all that, there's a process, and that's in the long term, and that's something we also need to talk about. But we also need to talk about how do you ensure that you and I can be able to access that bicycle to support us as we move forward in the future.
And even the durability of this bicycle as well.
Absolutely, and also given that there is still a whole number of people who are walking. There's a great number of people who are walking.
Yes.
They're walking because that's the only source of mobility that they have. But how far can they go, especially if they're not well? And that's how we need to have this conversation and ensure that people have access to health.
Right.
Exactly.
Could you paint for our viewers, for the map of Kenya, the presence of World Bicycle Relief, which areas they are in, because we definitely have a coverage of all the 47 counties. Absolutely. So they'd want to know, where is bicycle relief? How can I access that? So
currently, we're in the western part of Kenya. That's the bulk of where our program started, in the county of Siaya and the county of Kakamega. However, we have moved to Busia, Bungoma, Kitale. We come back down to Nakuru, Naivasha. In Nairobi, we have presence. We go down to the eastern part. We have in Wote, and Kitui, and then you go down to the coastal part.
It seems as if you're following the northern corridor.
No, the thing is, we need to be in many counties.
Yes, yes.
Resources are scarce.
Yes.
And that's the question. Access to health is actually the responsibility of the government. However, as an organization, this is something we care deeply. And we know the pathways to scale is, aside from us growing, but we also need to partner. So we come and partner with different people to ensure that the access grows to areas. I mean, the ASAL areas are areas we need to focus on. How do we ensure we focus there? We need resources to be able to do that. And so having these conversations help us, even with the little resources we have, talking to the different county governments to be able to headway and ensure they are purchasing these bicycles, but we bring the expertise to support a good bicycle program within the areas in terms of training the mechanics, looking at the youth within the area, giving them a source of income, training them to become mechanics, having outlets so that our spares are there to be able to support the bicycles so that they can maintain them. So in terms of sustainability, in terms of resilient, the bicycle will then offer the social mobility in terms of that.
Right. Someone says, good morning, I'm Joseph. Will I be required to buy this bicycle? So there are two ways. We are a social enterprise. So if you
can be able to afford, you go to a Gong Road and buy the bicycle.
Okay.
The money that you buy the bicycle is then plowed back into the business, and then we support those who can't.
Right.
Because one of our mantras is to support the vulnerable, the youth, and the girls. People who can afford, and there are people who will not be able to afford.
Okay.
But there are those who can, and there are those who have some form of income, so we can do through financial inclusion for them to be able.
Right.
But a great number of people are supported through the county government purchasing, through other individual organizations purchasing, and through the funds that we have.
Right.
So it depends on where they are.
Is it manufactured outside of the country, then brought in?
Yes, the bicycles are manufactured in Taiwan, brought in. We have an assembly in Kisumu, so we employ a great number of mechanics who assemble the bicycles, and then we distribute them in Kenya.
Right. Kulenya, I want to look at you look at the camera in front of you, and a clarion call, particularly now because you're really working with these sectors that you talk about, the partners, the county governments and the national government. What do we need to do to improve our community health promoters and even our healthcare logistics? Okay.
So my call is, and we've done a lot of data, we've done a lot of research, we just finished a randomized trial, control trial in Zambia, which accessed that 63% of community health workers who had access to bicycles, so more households. As we continue to professionalize the community health promoters in Kenya, mobility must be a key in the conversation. And we continue to speak to the Ministry of Health, we continue to engage the county governments, specifically those in the Ministry of Health, as we continue to work with community health promoters. One of their challenges as we continue to talk to them is distance. Right. And as World Bicycle Relief and Buffalo Bicycle, we offer that solution that we can be able to give them a good quality bicycle to access so that households can access health.
All right, thank you very much, Maureen Kulenyo. She's a Regional Director of World Bicycle Relief. We've learned a thing or two this particular morning. I hope you've also learned a thing or two to the national government, county government, Minister of Health. This is a very, very important bit. For those of us who do not know how to ride bicycles, this is the year, I think it will be by 2025 resolution.
It should be.
Oh yes, thank you very much for your time.
Thank you.
And speaking of buying things, well, are you in that whole season of, trying to see what will I buy for my loved one? Or where am I taking my mpoa? Or what do I do for business matters? Well, we're taking a short break. When we come back, we are giving you those tips with Lillian Kemuntu. Don't go too far.